station that you can own, and I think it's a station, that you can really prepare for. And I don't want people to lose marks because I think they get a little bit intimidated by it. It's a station where you have lots of choice about what you would do beforehand. But I think that with a little bit of preparation and just some sort of useful hints, then we can certainly get you good scores on the day. The first pieces of advice I always give people when preparing for their presentation is to follow the advice on the Neurology interview website, which tells you about the time limits, the clarity of your presentation, and the fact that you can't have any aids or sort of resources while you're presenting. Time limit is absolutely key, and I think that really shouldn't be understated. A case that is perfect in every other way but takes 3 minutes 30 seconds to present will not be scored well. You'll be cut off at 3 minutes. You might miss points that you wanted to tell them about.
In my daily practice, I think of professionalism along the 4 domains as outlined by the GMC. This include knowledge and skills, safety and quality, communication, teamwork, and maintaining trust. So the first one I think about in terms of professionalism is knowledge and skills. For me, this has been going to conferences such as the ABN conferences, the RCP conferences, allowing me to understand the latest research in both neurology and stroke, allowing me to understand where the specialty is going in the next few years and how I can develop my skills in terms of research and clinical to become a good neurologist going forward. Equally, I've been involved in a number of courses and training programs such as thrombolysis and good research practice. This again has allowed me to develop the appropriate clinical.
A case.
Presentation. Yes.
A presentation about something interesting in neurology or a case. How did you, because that's not something we have in cardiology, but it is something they have in some of the other specialties. So how did you find that?
Yeah, so I think it's quite a different kind of process, because usually when you present, you're used to like having visual aids, like you'll have a PowerPoint or you'll like, do something where you're writing and displaying something. And this one was very much you just talk at a screen. You don't have anything to show, so it's just you talking. And so it's very important in that one to like not waffle, put your key messages across, and also be interesting to keep their attention for 3 minutes. And so like one was actually delivery of the presentation, but then the other bit was also like actually choosing a topic that was relevant.